It's been more than 3.5 months since the global pandemic began, and Canadian hospitals have been working around the clock to ensure there's enough beds and supplies for when an outbreak occurs. Now, one North Toronto hospital has cause for a cautious celebration. No active COVID-19 cases in the ICU. It is the first time since March 14th for that to be the case for Humber River Hospital. Joining us now is Dr. Jamie Spiegelman, an internal medicine and critical care specialist at the hospital. Thank you so much, Doctor, for being with us tonight, and thanks for your service.
Well, thank you for having me.
Yeah, so you were tweeting yesterday, the hospital was tweeting yesterday that this was quite a celebration. Can you explain to me, how are people at the hospital feeling today?
Well, we've gone through 3.5 months of pretty serious illness where we were treating a disease we never treated before. So most of our staff, including physicians, nurses, were quite scared of this disease. And we were at numbers that were probably the highest in the GTA area. So the fact that we've been able to go down to zero patients in the ICU is quite celebratory for us. However, I think what more important for us were the individual wins. When we had individual patients that survived and were able to leave the ICU, that's when we really celebrated the successes more than, overall we're down to zero right now. We've had a lot of deaths, but we've had a lot of people survive, and those were really the big celebrations that we've had.
When you had those survivors able to walk out of the hospital, what did that mean for you personally?
It's a disease that we don't understand still, and it's a disease we didn't understand. We understand it a little more now, and we know how to treat it a little better now than we did 3 months ago or even a month ago. So to actually have somebody survive was a little bit of a relief because, our family members, my parents, friends, some of them got COVID, and I was worried that, you get COVID, you go to the hospital, and you're going to die if you go on a respirator. We've learned that that's not the case, that if you're relatively healthy, young, you might be on a ventilator, but there's a good chance you survive it. So, having successes, knowing that the work we put in as a team, not only doctors, nurses, respiratory therapists, ward clerks, medical imaging people, we've all been involved in these patients' care, and it's a group success. It's a multidisciplinary success when we see a patient leave the hospital, for sure.
And at one point, the ICU was at capacity. At its worst, what were things like? How stretched were your resources?
So our ICU was pretty stretched. We were probably the busiest ICU in the city, or one of the busiest ICUs in the city of Toronto. We have 48 beds. We were up to 120% capacity. Out of those patients, 20 patients of those that were actually in the ICU had floored COVID, on a ventilator, quite sick. But that doesn't tell the full story of our hospital, because at least double that were sent to other hospitals just because of capacity issues. So we had patients that came to our ICU, we stabilized them, and through the critical system, we transferred them to other hospitals that weren't as busy as we were. So I think overall we've treated about 50 or 60 patients in the ICU with critical illness with COVID-19 over the last 3 to 4 months.
I'm curious, this was such a new virus pandemic for us to deal with. What lessons did you and your team learn through all of this?
We're still learning. I don't think we have all the information yet, but the one thing we definitely did learn the most was initially the first couple of weeks was very scary, and we were afraid of our own health and bringing this disease home to our families. So we learned the proper way of treating these patients and actually putting on the proper PPE or personal protective equipment. I always find it funny when I hear PPE in the common population right now, just because prior to COVID it was a medical term, right? Do you have the right PPE on? But now everyone knows what PPE means. But so what we've learned is that the PPE that we use really protects us in the ICU. We have had no healthcare staff provider of any kind in the ICU that actually got COVID-19 from a patient. So we know what we're using, including N95 masks, gowns, face shields, gloves. We know what we're using is the appropriate equipment that we need. But we also learned how to put it on and how to take it off appropriately, where we have somebody watching us, making sure that we take it off appropriately, especially because that's when you self-contaminate the most. So we've learned how to do that way better than we've ever learned in our medical training.
There are so many words and so much language that we've really learned, all of us, throughout this pandemic. You just mentioned PPE. Another one is second wave, and officials have said all along that there could be a second wave in this. I know the hospital was saying that it's important not to take the foot off the off the brakes at this point in terms of trying to keep people safe and remaining vigilant. Can you explain to us how important is that right now?
It's very important. You know, when it first started, people were talking about flattening the curve, right? And what we're seeing is exactly that. This is actually what's happening in reality, where the whole point of flattening the curve was to make sure that healthcare resources, hospitals, are not overburdened, like they were in New York City, for example, or Italy, not overburdened, so we could handle the people that get really sick. So the fact is, the precautions that the government has given society, such as social or physical distancing, staying at home, closing restaurants, closing gyms, they actually worked, and we know they worked. But we still expect a trickle of COVID-19. This is a virus that's contagious. It's not gone. We know there are people every day popping up with it. So it's still going to be around, and we're still going to expect a trickle effect. But I think for the second wave, or whatever wave it comes, down the curve, with the flattening of the curve, we know how to treat it, and we know at this point what to expect a little better than the first wave. So I think from a healthcare provider standpoint, we're ready. Hopefully what's happening in Florida, Texas, or Arizona doesn't happen here. But I think if it does, we know that we could kind of handle it better than the first time if it exploded as much as we expected, which it didn't explode as much as we expected it to.
That is certainly reassuring for all of us to hear. Thank you so much for spending some time with us this evening, Doctor.
Thanks, Chris. No problem.
And that is Dr. Jamie Spiegelman from Humber River Hospital.